Hey everybody, this is Dr. Rosie here, and I wanted to just kind of sit down at the computer, and I'm actually going to shoot a couple videos, just break them up into little segments about probably the most, if not one of the most common questions we get, which, for those of you who either have either you yourself are the patient and you've been diagnosed with Parkinson's, or either Parkinson's like symptoms, or maybe you have a loved one, or a child or daughter or sibling, or so to speak, and you have questions about Medicare and how it can relate to those with Parkinson's. Well, we'll get to that, but first I actually want to start with is really, what is Medicare? So as my name, Dr. Brandon Rosie, we are a Medicare contracted provider, which means that Medicare actually does provide payment to us for providing certain medical covered services. However, a lot of patients seem to be misconstrued with what Medicare is, what exactly it entails, how you qualify for it, if you're not over the age of 65, which is with the federal guidelines where you do qualify for it if you don't have any other special circumstances, as well as if you have true Medicare. And I always try to tell my patients, like, if you have true Medicare, everyone is going to look the same, or do you have what's known as a Medicare Advantage plan, which actually is not a Medicare plan. So part one of this video, we're going to talk about just what is Medicare. So I've got you up on just a standard, internet web browser, and right now it's on Google. So what I'm going to do is we're just going to type in, we're going to go straight to the source, medicare.gov, and you can see it there on the screen. I'm going to click enter, and here you go. So this is exactly what the plan should look like, the website should look like. Luckily for us, the government doesn't like to make a lot of changes because it is such a robust website. They do make updates all the time, but they traditionally try to leave that first page alone because they don't want to make it any more confusing than it already is. It is a confusing, quite nuanced subject in the beginning. So So if you have any questions regarding Medicare, regarding your Medicare Part A, which is for hospital plans, or Part B, which is for your outpatient or doctor's offices, your primary care doctor, your specialist, that's all under Part B, as well as your physical therapist, your speech therapist, your occupational therapist, your audiologist. All of those are all considered specialists. They are all participated under Medicare Part B. So what exactly the quickest and most simplest way to know if you have Medicare? And let me open up another page here. We're going to go to Medicare. I'm just going to search it this time, Medicare, and we're going to pull up an image. And so here you go. This image right here, if you can see where my cursor is right here, this is the insurance card you will have. If you do not have this card, and to be fair, many patients will get this card and then relinquish their Medicare for a Medicare Advantage plan. But if you have this card and this is the only insurance card you have, then you have traditional Medicare. It will say Part A, which is for hospital. It will say Part B. Now this one right here is in Spanish, but this is just your Medicare number. Part A, again, is for your hospital. Part B is your outpatient. And it'll tell you what day your coverage begins. At what point in time do you start to have any medical coverage? It typically is an alphanumeric number. There will be some letters, there will be some numbers, traditionally in 4-3-4 more. As long as your coverage start date is before the date you actually have services, whether in the hospital or outpatient services, Medicare Part B, then you would or should be covered for those services, for the services that are allowable, that are able to be billed for those said services. Physical therapy is indeed, covered by Medicare and other third-party private insurance. However, that doesn't mean that the entire treatment is always covered. Typically at that point, your therapist or the company you're working with should always have a very open, honest conversation with you about what services they expect that either will or should be covered, and what services they may question and say, hey, we're going to try to bill Medicare, but we don't know if they're going to cover. But traditionally, you either know it's going to be covered or it won't be covered. And either way, that should be a informed consent that is on from you, being the patient or the patient's friends and family that are participating in the plan. So over here, sorry about that. So In order to get services from Medicare, in order to obtain services from Medicare, you must have a physician. You must have a primary care doctor. You must have some physician. Technically, doesn't have to be a primary care doctor, although I think most healthcare providers will agree that you need to have a primary care provider. If you have Parkinson's, in all likelihood, you also have a neurologist. You probably also have a cardiologist. Any of these specialists, they're all physicians. They're whether they have a doctor of osteopathic medicine, a DO, or an MD, an allopathic doctor. They have the MD, the traditional MD route. Either one of them could actually write and certify a plan of care and allow you to, receive physical therapy and it be a covered service. In addition to that, you can also get those services ordered and prescribed via a nurse practitioner or a physician assistant, as they both operate under a supervising physician. So it doesn't matter what their subspecialty is, as long as they are as long as they are a clinician that is allowed under Medicare guidelines, under Medicare rule, that they are allowed to certify that plan, then you may receive a prescription and or a referral, and it should be covered. Now, that does not mean that just because you are provided a referral from a doctor that Medicare will guarantee cover the rates. Unfortunately, this seems to be the biggest misconception between medicine, is that, well, the doctor wrote me the prescription, well, then it must be covered. Actually, no. The doctor writing the prescription is just a recommendation saying, I refer to this drug, this service, this medical scan, whatever it is that the doctor is writing for, and then it is up to the insurance provider, whether it's Medicare, a third-party payer, a different private insurance, or just paying cash directly out of pocket from the patient. No matter how that is, it's determined. If you want it to get paid for by somebody else or even Medicare, then you have to go through the list and the loops that they want you to go through. So like I said, if you have traditional Medicare Part A or Part B, then you have Medicare. If you have Medicare Part B, you have to have Medicare Part A. Part A is guaranteed. It's given to you at the age of 65, or there are special circumstances where you may get Medicare without having to be 65. We will talk about that in a later video. But right now, I want to make this short, sweet, and just a guideline as to, if you have Medicare, how do you know? Well, you're going to have a card that's going to look like this. It's going to have that alphanumeric number. It will say Hospital Part A. It will say Medical Part B. If it does not say Medical Part B, or just Hospital Part A and B, or sometimes it'll just say Part A and B, then you will, sometimes it'll look like this, then you do not have Part B. If it just says Part A, then that's all you have is Part A. And if it says Part B, then you traditionally have Part A and B. Once again, if you have any questions, please reach out in the comment section. Feel free to email us anytime, and I will help answer the questions as best I can. Thank you so much for watching.